ನಮಸ್ಕಾರ ಎಲ್ರಿಗೂ. ನಾನು ಯಶ್ಮತ್ ಮಾತಾಡ್ತಾ ಇದ್ದೀನಿ. ನೀವು ನೋಡ್ತಾ ಇದ್ದೀರಾ ಇಶಾ ಬುಲೆಟಿನ್. ಏನಂತಂದ್ರೆ, ಈಗ ನಾನು ಬಸವನಗುಡಿ ಬಳಿ ಇರುವಂತಹ ಅಜಿಲಸ್ ಡಯಾಗ್ನೋಸ್ಟಿಕ್ ಸೆಂಟರ್ ಬಂದಿದ್ದೀನಿ. ಇದು ಕೇವಲ ಡಯಾಗ್ನೋಸ್ಟಿಕ್ ಸೆಂಟರ್ ಅಲ್ಲ, ಇಲ್ಲಿ A to Z ಏನು ಹೆಲ್ತ್ಗೆ ರಿಲೇಟೆಡ್ ಆಗಿ, ಎಸ್ಪೆಷಲಿ ಕಾರ್ಡಿಯೋ ರೀನಲ್ ಮೆಟಬಾಲಿಕ್ ಗೆ ಸಂಬಂಧಪಟ್ಟಾಗೆ 3 ಸ್ಪೆಷಾಲಿಟಿ, 3 ಡಾಕ್ಟರ್ಸು, 3 ವಿಚಾರ, 3 ವಿಷಯಗಳು ಒಂದೇ ಪ್ಲಾಟ್ಫಾರ್ಮ್ ಅಲ್ಲಿ. ಒನ್ ಕ್ಲಿನಿಕ್, ಸ್ಮಾರ್ಟ್ ಕ್ಲಿನಿಕ್ ಫಾರ್ ದಿ ಪೀಪಲ್, ಸ್ಮಾರ್ಟ್ ಪೀಪಲ್ ಮತ್ತೆ ಸೇವೆಯಲ್ಲಿ ಬೇಕಾಗಿರೋಂಥ ಜನರಿಗೋಸ್ಕರ ಅಂತ. ಇಲ್ಲಿ ಏನು ಫೋರ್ಟಿಸ್ ಅವರ ಪಾರ್ಟ್ನರ್ಶಿಪ್ ಅಲ್ಲಿ ಈ ಅಜಿಲಸ್ ಕ್ಲಿನಿಕ್ ನಡೀತಾ ಇರೋಂಥದ್ದು. ಇದು ಒಂದು ಪ್ರೈಮ್ ಲೊಕೇಶನ್ ಅಲ್ಲಿ ಇದೆ. ಹಾಗಾಗಿ ಈ ಕುರಿತಂತ ಒಂದು ಮಾಹಿತಿ ವರದಿ ಇಲ್ಲಿದೆ, ದಯವಿಟ್ಟು ನೋಡಿ. ಇದ್ರ ಸಂಬಂಧಪಟ್ಟಾಗ ಏನಾದ್ರು ಇದ್ರೆ ಕಮೆಂಟ್ ಬಾಕ್ಸ್ ಅಲ್ಲಿ ಕಮೆಂಟ್ ಮಾಡಿ ತಿಳಿಸಿ. ಜೈ ಹಿಂದ್.
Spoken for a very long time. It has taken us time to get this to materialize, and it has been based upon a very simple concept. In fact, if you look at this, which we'll share with you, this was the front page news in the mainstream yesterday on Deccan Herald, which is a study done across the country and specifically looking at Karnataka. And we found some heart problems has increased exponentially in the last decade. And what usually happens is, illond doctor noಡ್ತಾರೆ, but majority of these patients who have got metabolic problems, kidney problems and heart problems, they overlap quite together. And we were looking for a space wherein we could provide an integrated approach or an integrated therapy for the patients, if starting from diagnosis, looking at the risk factors, developing treatment modules so that all 3 specialities are addressed in the same setting. And this is where this unique opportunity came, wherein Fortis as well as Agilus had this excellent unit which has got all the facilities available, including diagnostics. They have got facilities for us to consult, and so we brought this concept of a CMR clinic or Cardio-Renal-Metabolic clinic, and this addressed all this. And I think this is a unique opportunity. This is one of the first in the city and in the state to address this serious health problem together.
With lifestyle diseases. Now, since we have conquered infectious diseases this century, we are basically dealing with lifestyle diseases, which includes obesity, even though it may not fulfill the criteria of diabetes, but it increases the risk of heart and kidney diseases. So basically, heart diseases, diabetes, kidney diseases, we call them by different names, but these are all lifestyle diseases. And our aim is to put it under one banner and try to treat it simultaneously. So this is the whole concept, that yes, 40% of diabetics will have some kidney disease. They will have a lot of heart disease as well. So if we target them as a single, as a unity, we'll be able to provide better care to the patients. And the advantage to the patients would be that under a single roof, under a single consultation, they'll be meeting 3 specialists who will be targeting it from all the sides, so that we are able to counteract and treat these
metabolic health. Previously, the diabetes, how we used to treat is, just controlling the sugars or the blood glucose level. Now the concept is completely changed. We have to take care of all the organs which diabetes might affect. Like if someone who is diabetic has increased risk of getting MI, kidney disease, or they might end up with dialysis. So as I told, all the diabetes patients might not have outer kidney disease, but if someone is diabetic, they are at risk of getting heart and kidney disease. Same time, if someone has cholesterol issues, they have increased risk of getting BP and hypertension. So like that, we will be giving very integrated approach. And not only that, like now obesity is also increasing drastically. I think now so many drugs or fitness things are coming to control it. So again, the obesity, if you are obese, again cholesterol will be high, BP, you are at risk of getting diabetes and BP, and also heart disease, and also like indirectly to kidney issues. So at last we are concentrating on cardio-metabolic health.
Director, Fortis Hospital, Bannerghatta Road. First of all, I thank all the clinicians to have come together and started something which is very remarkable for the population. ಬಸವನಗುಡಿ ಅನ್ನೋದು ಬೆಂಗಳೂರಿನ ತುಂಬ ಹಳೆಯ ಏರಿಯಾ. ಹಾಗಾಗಿ the old Bangalore area. Malleshwaram agli, Basangudi agli, it's very important that we take care of our old Bangalore. Agilis mate Fortis, it belongs to the same company, the organization, the parent company is the same. And this is the first of our clinics that we have opened, which is AGILUS-FORTIS Clinic. So through these clinics, we want to reach out to the local, hyper-local population. ಸೊ ತುಂಬ ಜನ ಹಾಸ್ಪಿಟಲ್ಗೆ ಬರೋಕ್ಕಾಗಲ್ಲ, ತುಂಬ ದೂರ ಇರುತ್ತೆ. ಬೆಂಗಳೂರು ಟ್ರಾಫಿಕ್ ಸಿಚುವೇಶನ್ ಗೊತ್ತಾದ್ಮೇಲೆ ಒಳ್ಳೆ ಡಾಕ್ಟರ್ಸ್ ನೋಡೋಕ್ಕೆ ತುಂಬ ಕಷ್ಟ. ಹಾಗಾಗಿ ನಾವು ನಮ್ಮ ಬಸವನಗುಡಿಗೆ ನಾವೇ ಬಂದಿದ್ದೀವಿ. ಬನ್ನರ್ಘಟ್ಟ ರೋಡ್ ಇಲ್ಲಿಂದ ಒಂದು 6 ಕಿಲೋಮೀಟರ್ ಇರ್ಬೋದು, ಬಟ್ ಒಂದು ಅರ್ಧ ಗಂಟೆ ತಗೊಳುತ್ತೆ. ಬಟ್ ಈ ಕ್ಲಿನಿಕ್ ಮೂಲಕ ನಾವೇನ್ ಮಾಡ್ತಾ ಇದೀವಿ, ನಮ್ಮ ಒಳ್ಳೆ ಡಾಕ್ಟರ್ಸ್ ಬನ್ನರ್ಘಟ್ಟ ರೋಡಲ್ಲಿ ಏನಿದ್ದಾರೆ ಎಲ್ಲ ನಮ್ಮ ಏರಿಯಾಗೆ ಬರ್ತಿದ್ದಾರೆ. ಬಸವನಗುಡಿ ಆಗಲಿ, ಮಲ್ಲೇಶ್ವರಂ ಆಗಲಿ, ಅದೆಲ್ಲ ನಮ್ಮ ಹಳೆ ಬೆಂಗಳೂರು, ನಮಗೆ ಗೊತ್ತಿರೋದೇ 4-5 ಜಾಗ. ಹಾಗಾಗಿ ಒಳ್ಳೆ ಹೆಲ್ತ್ ಕೇರ್ಗೆ ಆಕ್ಸೆಸ್ ಕೊಡೋಕ್ಕೆ ಇದೊಂದು ನಮ್ಮ ಪ್ರಯೋಜನ.
One of the most esteemed doctors of Fortis Bannerghatta, they are going to visit our facility of Agilus in Baswangudi. It's a great opportunity for the neighborhood people to get access to the best of the healthcare and at a very convenient distance from their homes. I'm very sure that with their expertise, Dr. Rajpal, Dr. Parekh and Dr. Anusha, they will be really helping all the patients in the neighborhood with the best of the treatments. And at Agilus, we have got some of very good testing profiles, and also we have a very good facility out here. So I'm sure that this whole thing of CRM will add another feather to the cap, and looking forward to many more people visiting the facility soon. Thank you.
ಸೊ ಕೆಲವು ಜನಕ್ಕೆ ಒಂದು ಪ್ರಾಬ್ಲಮ್ ಜಾಸ್ತಿ ಇರುತ್ತೆ, ಬಟ್ ಮಿಕ್ಕಿದೆಲ್ಲ ರಿಸ್ಕ್ ಇರುತ್ತೆ. ಟು ಗಿವ್ ಯು ಅನ್ ಎಕ್ಸಾಂಪಲ್, ಆಫ್ 10 people who develop kidney disease, only 1% or 10% will, 1 out of 10 will go to dialysis. The rest of 9 of the people will die because of heart diseases. ಬಟ್ ಒಂದೇ ಜಾಗದಲ್ಲಿ ಕೂತ್ಕೊಂಡು ಒಂದೇ ಪ್ರಿಸ್ಕ್ರಿಪ್ಷನ್ ಕೊಡಲ್ಲ, ಅದೇ ನಾವು ಮಾಡೋದಕ್ಕೆ ಶುರು ಮಾಡಿದೆ.
Sedentary life ಇರುವಾಗ people, when they're trying to do more than what they should do, they're not concentrating on their health, not exercising, ತೂಕ ಜಾಸ್ತಿ ಆಗುತ್ತೆ, ಬೊಜ್ಜು ಜಾಸ್ತಿ ಆದಾಗ ಹಾರ್ಟ್ ಪ್ರಾಬ್ಲಮ್ಗಳು ಬರುತ್ತೆ, BP ಪ್ರಾಬ್ಲಮ್ಗಳು ಬರುತ್ತೆ, ಶುಗರ್ ಜಾಸ್ತಿ ಆಗುತ್ತೆ. ಇವನ್ನೆಲ್ಲ ಕಾನ್ಸಂಟ್ರೇಟ್ ಮಾಡಿದ್ದು ಒಂದು ಜಾಗದಲ್ಲಿ ವಿ ಹ್ಯಾವ್ ಎನ್ ಇಂಟಿಗ್ರೇಟೆಡ್ ಅಪ್ರೋಚ್.
ಮತ್ತೆ ಇಲ್ಲಿ ಹೋಗೋದು, ಅಪಾಯಿಂಟ್ಮೆಂಟ್ ತಗೊಳ್ಳೋದು, ವೆಯ್ಟ್ ಮಾಡೋದು, ಅದೆಲ್ಲ ಎಷ್ಟೋ ಕಡಿಮೆ ಆಗುತ್ತೆ. ಪ್ಲಸ್ ನಾನೊಂದು ಟ್ರೀಟ್ಮೆಂಟ್ ಬರ್ದಿರ್ತೀನಿ, ಇವರು ಇನ್ನೊಂದು ಬರೀತಾರೆ, ಅದು ಓವರ್ಲ್ಯಾಪ್. ಕೆಲವು ಸಲ ಏನಾಗುತ್ತೆ, ಎರಡೂ ತಗೋಬಿಡ್ತಾರೆ, ಅವರಿಗೆ ಗೊತ್ತಾಗೋದಿಲ್ಲ ಎಕ್ಸಾಕ್ಟ್ಲಿ ಏನು ತಗೊಳ್ಬೇಕು ಅಂತ. ಸೊ ನಾವು ಇವಾಗ ಕರೆಕ್ಟ್ ಆಗಿ ಒಂದು ಪ್ರಿಸ್ಕ್ರಿಪ್ಷನ್, ಲೈಕ್ 3 ಜನರಿಂದ ಒಂದು ಪ್ರಿಸ್ಕ್ರಿಪ್ಷನ್, ಅದು ಕೂಡ ಅವರಿಗೆ ಹೆಲ್ಪ್ ಆಗುತ್ತೆ.
So for example, in a case like a cancer treatment, okay, cancer is a comprehensive 360 holistic treatment. We have evidence. So what we practice is evidence-based medicine. Doctors will agree. Please correct me, I'm not a medical. But we know that, for example, yoga meditation helps in cancer treatment. So we have integrated whichever has evidence, we have integrated. But basically the system of treatment that Fortis follows is allopathic treatment. But whatever is complementing the treatment, like in cancer care, I can sure tell you that yoga, meditation ಖಂಡಿತ ಹೆಲ್ಪ್ ಆಗುತ್ತೆ. ಅಂಥದ್ದು ನಾವು ಇಂಟಿಗ್ರೇಟ್ ಮಾಡಿದ್ದೀವಿ. ಐ ಮೀನ್ ಇಟ್ ಇಸ್ ಡಾಕ್ಟರ್ಸು ಹೇಳ್ತಾರೆ ಖಂಡಿತ ಮಾಡಬೇಕು ಅಂತ. But I don't think as such in this place there will be Ayurvedic or other format of medicine other than allopathic.
Evidence for other specialties, as Mr. Gautam clearly said, we are experts in this form of treatment, and we have got years of clinical studies which proves that what we are doing is the right thing for this kind of diseases. So we put together what is evidence-based practice, and if there are complementary areas, we do not want to poo-poo the benefits of other systems. If there are any complementary areas, they can always look for supplement that in addition to what they are getting through our clinics.
ಅಂಡ್ ಡಾಕ್ಟರ್ ಆಶಿಕ್ ಪರೇಖ್ ಇಸ್ ಸೀನಿಯರ್ ಕನ್ಸಲ್ಟೆಂಟ್ ಡಾಕ್ಟರ್ ಆ ಥರ ಇದರಿಂದ ನಾವು ಏನಂದರೆ ಡೆಫಿನೆಟ್ಲಿ ನೈಬರ್ಹುಡ್ಗೆ ಹೆಲ್ಪ್ ಆಗೋಕ್ಕೆ ಈ ಪ್ರೋಗ್ರಾಮ್ ಮಾಡ್ತಾ ಇರೋದು. ಆಲ್ವೇಸ್ ಎನ್ಕರೇಜ್ಮೆಂಟ್ ಇಸ್ ಆಲ್ಸೋ ಇಂಪಾರ್ಟೆಂಟ್. ಈ ಎನ್ಕರೇಜ್ಮೆಂಟ್ ಅಂದರೆ ನಾವೇನಂದರೆ ಪೇಷಂಟ್ ಬರಲಿ ಅಂತಲ್ಲ, ಯಾರಿಗೆ ಪ್ರಾಬ್ಲಮ್ ಇದೆಯೋ ಅವರು ಇಲ್ಲಿ ಬಂದರೆ ಅಂದರೆ ಅವ್ರಿಗೆ ಸೊಲ್ಯೂಷನ್ ಸಿಗುತ್ತೆ ಅಂತ ಒಂದು ಇದಷ್ಟೇ.
ಟ್ರಾಫಿಕ್ ಅಲ್ಲಿ ಆಂಬ್ಯುಲೆನ್ಸ್ಗೆ ಜಾಗ ಕೊಡ್ತಿದ್ದಾರೆ. ಇವಾಗ ನಾವು awareness has come that they make space for an ambulance. So that is something that is brought in. Now if we raise the awareness in the population that look, a person who's got kidney problem, a person who's got heart problem, a person who's got metabolic problem, all of these people are at risk of end organ damage involving the heart, the brain, the kidneys and everything. So we are doing a big favor to people by getting them to understand this. Now, if you come with end organ damage, for example, someone comes with chest pain, they come into our clinic, we have got an ECG 24/7. Whenever the clinic is open, there's an ECG machine. So the ECG machine does the ECG. Those ECGs are sent straight away through to me or whoever is the cardiologist, so that they will address, okay, this requires emergency treatment. And we have a fleet of ambulances between Fortis and neighbors also, wherein we can shift these patients for emergency treatment as soon as possible. So the network of us having 7 hospitals across the city, and one of the major hospitals of our chain is at Fortis Bannerghatta Road, which is a multi-speciality hospital. It has got everything under one roof, both in terms of diagnosis, supported by AGILUS and Fortis hospitals. We've got 2 cath labs, we've got 14 or 18 dialysis machines, we've got senior metabolic clinicians like Dr. Anusha. So a patient comes, he has a heart attack, he's got a sugar which is high. The first thing we will do is give a reference to Dr. Anusha. She will come and manage the metabolic side of it. Dr. Ashish and Dr. Rajan and other nephrologists will come in and pitch in for looking at the kidney problems. Thereby, at the end result, we've got a unified treatment for the patient and they get treated. This is